They told you that you have arthritis and need surgery? Attention, in 80% of cases, even with confirmed arthritis, the lion's share of the pain does not come from the joint. It comes from muscles that are trying to save this joint and go into chronic spasm. If we don't remove this muscular block, even joint replacement may not rid you of pain. Let's check right now. Is it the bone or the muscle that hurts? Lie on your side, affected leg on top. Straighten it. Now lift it up, and with your hand press down hard on the thigh, creating resistance. If the pain is sharp and deep, like a needle in the joint, possibly it's the joint. If the pain is pulling, burning, and intensifies with tension, it's the muscles. And that's excellent news, because we can fix this right now. If you felt a burning pain, congratulations. This is treatable without surgery. But to cure it, you must understand the mechanics. Why are these muscles trying to crush your joint? Many think that arthritis is simply time has come. No, often, the joint is destroyed by its own neighbors. Anatomically, everything looks simple. The femoral head enters the acetabulum. This is the bony framework. But this framework is controlled by a complex system of 22 muscles that cross the joint or directly influence the movement of the femoral head. Posteriorly, 6 deep rotators, the piriformis muscle and its small helpers. Below, hamstrings. Laterally, abductors, Gluteus medius and minimus, as well as TFL. Anteriorly, flexors, the powerful Iliopsoas and Rectus femoris. Medially, 5 adductor muscles, one unfortunate joint against 22 muscles. When this orchestra plays in harmony, you fly. But once you sit in a chair for 8 hours a day, the balance collapses. If at least half of them are in spasm, the hip joint has no chance. Let's conduct a deeper analysis. Our best friend, who turned into a treacherous enemy, is hiding deep inside. Let's look under the gluteus maximus. The secret 6, piriformis muscle and short rotators. They're small, but they lie directly on the joint capsule. They literally hug the femoral neck from behind. When they go into spasm, they work like a horizontal screw. They screw the femoral head into the acetabulum with incredible force. The gap disappears instantly. That aching pain deep in the buttock, it's your joint crying out. It's literally suffocating from tightness, deprived of lubrication and freedom of movement. But mechanical compression is only half the trouble. These little terrorist muscles have another weapon, trigger points. Imagine that the fibers of your piriformis muscle have tangled into rigid knots. These knots are like delayed action mines. When they're active, they shoot pain not where they're located, but send it throughout the entire region. Does your sacrum hurt? It's the piriformis. Does it hurt deep in the buttock? Piriformis. Is the back of your thigh pulling? Again it. And now the worst part. Next to these muscles runs the thumb-thick sciatic nerve. When the secret 6 is in spasm, it literally strangles this nerve. And here it's important not to confuse things. Listen to your body. If the pain is electric and shoots below the knee, into the shin or foot, it's the nerve. It's being compressed. If the pain is dull, aching and sits in the buttock or thigh, it's trigger points. But the bad news is that in 90% of cases you have both. Muscle spasm creates triggers and simultaneously strangles the nerve. How to understand that this is about you without getting up? Look at your habits. Symptom 1, spinning top. It's hard for you to sit still. You constantly fidget, change position. Symptom 2, leg over leg. Try to cross your affected leg over the healthy one. If the leg won't bend or it hurts, the muscle is shortened. Symptom 3, windshield wiper. Lie on your back and relax your legs. If the foot of the affected leg has fallen outward more than the healthy one, your rotators have twisted the femur and locked it. Enough theory. Let's find this enemy physically. Right now, take a tennis ball or any hard object. Get down on the floor or on a firm couch. Place the ball exactly in the center of the buttock. Transfer your body weight onto the ball. Start rolling slowly. If you found a point where sparks fly from your eyes, you found the epicenter of the problem. And now, the main secret. Find the most painful point. Stop. And in this position, try to bend your leg at the knee and move it to the side, like a frog. Do you feel pain? Hold for 30 seconds. The pain should begin to subside. If the pain goes away, it means the joint has nothing to do with it. We just proved that the problem is in the soft tissues. But the posterior surface is only the rear. We're being attacked from the front as well. Meet hip flexors. This is a powerful tandem, Iliopsoas muscle and Rectus femoris. These are the main victims of our lifestyle. We sit for hours. In this position, these muscles get used to being short, frozen, in a compressed state. But the worst thing happens when you finally stand up. Do you think they relax? No, they remain taut, like steel cables. Look at the force vector. It goes straight up. These muscles work like a powerful jack. They pull the femur vertically, literally pressing the head of the joint into the very top of the socket, into its roof. The joint ends up suspended on these muscles. And with every step you take, the femoral head strikes against the upper edge of the acetabulum. The cartilage wears away precisely at the top point. But this jack breaks not only bones. At the exit point from the pelvis, the Iliopsoas muscle passes through a narrow bottleneck, and the femoral nerve runs there too. When the muscle swells from spasm, it strangles this nerve. Attention! Pain from this can go not into the leg, but into the most delicate places, into the groin, and even into the genitals, scrotum, or labia. Many spend years treating urology or gynecology, but the problem is muscle spasm. And now, the map of minefields. This muscle has 3 favorite trigger points that deceive even doctors. Point near the spine gives pain to the lower back. You treat a hernia, but it's the muscle. Point in the pelvis shoots into the sacrum. Point near the femur gives pain to the groin and anterior thigh. And there's a completely unexpected fact. This muscle lies so deep that even intestinal problems, constipation, can press on it from inside, activating pain. Imagine how interconnected everything is. How to recognize this enemy face to face. Look at yourself from the side. You sleep only on your side, legs drawn up. It hurts to straighten out on your back. You got up from a chair, but can't straighten up right away. You need time to walk it out. To compensate for short muscles, your body arches the lower back, hyperlordosis, and sticks the pelvis backward. The belly protrudes forward, the back is overloaded. Disc hernias here are simply a matter of time. You might say, I stand straight, everything's fine with me. Let's do the Thomas test right now. It will show the truth in 10 seconds. You'll need the edge of a table or firm bed. Sit on the very edge so your buttocks almost hang off. Lean back onto your back. Pull one knee with your hands to your chest as tightly as possible. The other leg should hang down freely. Look at the hanging leg. Normally, the thigh should lie on the bed or hang parallel to the floor. But if your knee sticks up like a barrier, and you can't lower your leg without arching your lower back, test is positive. Right now, this jack is active in destroying your joint. We just saw how the flexors pull the joint upward from the front, but the trap hasn't fully closed. Look at the back of the thigh. Here are located the powerful hamstrings. They run along the entire bone, like suspension bridge cables, from the ischial tuberosity, on which you sit, all the way to the knee. When they're tight, they work like taut, dried out rubber. They try to pull the shin toward the pelvis, but the bone can't compress. Therefore, all this monstrous force goes into a compression vector. The hamstrings literally drive the femoral head vertically upward, straight into the cartilage of the acetabulum. Together with the flexors in front, they create the effect of a hydraulic press. The joint finds itself under colossal pressure, even when you're simply standing. And when you walk, every step you take is not cushioning, but a rigid strike of bone against bone, because the muscles that should spring have turned into rigid steel cables. But this press also knows how to shoot pain. The hamstrings have their own favorite targets, trigger points, that are confused with radiculitis. If the problem is in the semitendinosus and semimembranosus muscles, which are located on the inner part, the pain sits in the gluteal fold, where the leg transitions to the buttock and descends along the inner side of the thigh to the knee. Often people think it's the meniscus or knee ligaments, but it's the thigh muscle. If the biceps femoris is acting up, which is located on the outer part, then the pain goes along the outer side, captures the popliteal fossa, and can go down into the calf. How to understand that your hamstrings have dried out. It hurts to sit on a hard chair. The pain intensifies precisely under the buttock. When walking, you can't fully swing your leg forward, your stride becomes shorter. You can't find a comfortable place for your leg at night. Let's check the length of your cables right now. Sit on the floor or on a couch. Straighten your legs in front of you. Knee straight. And now try to reach your toes with your hands. If you can't reach even to your shin, feel hellish tension under your knees. Your back is rounded, and your leg bends by itself. It means your hamstrings are critically shortened. They're holding your pelvis and joint hostage. But the good news, they're very easy to turn off. We'll need a ball again, better a larger one, but a tennis ball will do, or even a hard water bottle. Sit on a chair or hard surface. Place the ball under the back surface of the thigh. Start from the very top. under the gluteal fold, where the bone you sit on is. Press with the weight of your leg onto the ball. Roll slowly. Look for seals that feel like painful strings. Found a point? Stop. Breathe. Press on it for 30 seconds. You'll feel the string relax and warmth spread down to the knee. This exercise doesn't just relieve pain, it releases the vise in which your joint is clamped. So, we've released the vise from behind, in front, and below, but the joint still isn't free. The lateral side is holding us. Here is located the group of abductors. This is a powerful trio: Gluteus Medius, Gluteus Minimus, and tensor fasciae lati, TFL. Their mission is noble. They stabilize the pelvis when you stand on one leg. But when they go into spasm, they turn into an external press. Look at the mechanics. They attach to the greater trochanter, that bone on the side. Contracting, they pull the femur toward the pelvis with monstrous force. They literally drive the femoral head deep into the joint socket, destroying the lateral gap. These muscles are masters of disguise. They create phantom pain that deceives even doctors. Triggers in gluteus medius shoot into the lower back, along the belt line and into the sacrum. You spend years treating osteochondrosis, rubbing your back, but the fire is burning in the hip. Gluteus minimus is the most insidious. It sends pain down the stripe, all the way to the shin. This feels exactly like nerve compression from a hernia. But the spine MRI is clean, because the problem is in the muscle. This pain is exhausting. It intensifies when you get up from a chair or stand for a long time. Eventually, you start limping, shifting weight to the healthy leg, or take a cane. Let's unmask them. 2 tests that will show the truth in 30 seconds. Test 1. Lie on your healthy side. Bend the affected leg at the hip to 90 degrees. Bring the knee forward. Now just relax the leg and allow the knee to fall to the floor. Normally, the knee easily touches the floor. If the knee hangs in the air and won't descend, your abductors are stone. They physically won't let the joint go. Test 2. Sit on a chair. Try to cross your affected leg over the healthy one with the ankle on the knee. If you can't do this, or feel sharp pain and tension on the outside of the thigh, test is positive. The lateral press is active and is wearing away your joint right now. But the trap closes completely precisely here, on the inner surface. These are the adductor muscles. In spasm, they do a terrible thing. They literally suck the leg inward toward the pelvis. Look at the force vector. The muscles pull the bone toward the groin, and the femoral head crashes into the inner wall of the joint. Cartilage begins to rub against cartilage under monstrous pressure. The joint turns into dry millstones. It doesn't glide, it grinds itself with every step. This is no longer just pressure, it's a deadlock. These muscles hit the most vulnerable spots. Recognize your pain, pectineus and adductor longus. Give dull, aching pain in the very depth of the groin. It seems to you that the joint itself or lymph nodes hurt, but it's the muscle. The pain spreads along the inner side of the thigh and intensifies when you try to spread your legs. Gracilis muscle. It runs like a taut string along the entire thigh. In spasm, it gives sharp, burning pain that doesn't go away even at rest. Adductor magnus muscle. This is the worst. Its upper triggers shoot not into the leg, but inside the pelvis. Pain goes to the pubic bone, into the rectum, bladder, and genitals. People spend years treating cystitis, prostatitis, and inflammation. Take antibiotics. But the cause is muscle spasm that simply mimics pain of internal organs. Let's check your millstones. Butterfly test. Lie on your back. Bend your legs at the knees. Put your feet together. And now allow your knees to freely fall apart to the sides, like butterfly wings. Relax. Normal. Your knees should descend almost to the floor. Between knee and floor, maximum a fist or 2. You feel pleasant stretching. If your knees stick up high, like a grasshopper's, and you feel a rigid stop in the groin that won't let your legs down, your adductor muscles are shortened. They're holding the joint in a vise right now. Now put everything together. The picture is horrifying. Below and in front, a vertical jack. Laterally, external vise. Medially, pressure lever. Posteriorly, screwing bolt. Your joint is under circular siege. Doctors look at the X-ray, see worn cartilage, and deliver the verdict: coxarthrosis. But worn cartilage is not the cause. It's the consequence. It's simply evidence at the crime scene. The real killer is the muscular shell that has been grinding the joint like millstones for years. Understand one thing. Until we lift this siege, no injections, chondroprotectors, expensive ointments, and plasma will help. This is physics. Trying to treat cartilage without relaxing the muscles is like lubricating a bearing with oil that's clamped under a press at 100 atmospheres. The pressure goes nowhere. But there's good news too. This shell consists of muscles. This isn't bone, this isn't metal. And we know how to relax muscles. And this changes everything. As soon as we remove the spasm, the vise will release. The gap in the joint will appear again. Fluid will start circulating. Pain will retreat because its cause will disappear, mechanical compression. In the next video, we'll start methodically breaking this circle of death, muscle by muscle, knot by knot, to return your joints right to free movement. Like and subscribe so you don't miss the salvation of your joint. And while the new video is being prepared, right now watch my detailed guide about getting rid of groin pain caused by adductor muscles. Link on screen and in description. Start your liberation with it.